Next thing that we want to cover is called, if I'm saying this correctly, pulse oximeter. I think some people refer to it as a pulse ox monitor. So you want to tell us a little bit about those?
Sure. And that's another one of the simple measurements that we can make at home. And this is a little pulse oximeter. And what does it do? Well, as we talked about, the heart is pushing the blood through the body, and the lungs are obviously a big part of the body. So the tiny little blood vessels in the lungs, as the blood goes through there, they pick up oxygen. And one of the ways that we can measure the oxygen level is by using one of these little handheld home oxygen meters. You may see these in the doctor's offices. At work, I use one of these sometimes on patients. So what this does is it's measuring the percentage of oxygen that's saturating the red blood cells. And so the little pulse oximeter is, you don't have to buy something that's really expensive, that costs a lot of money. Most of these are very reliable these days. And so you're going to open it with the little clamp like that. And another thing I want to show you is that the way that the pulse oximeter measures the oxygen level is that it has a little light in it. And you can see the little red light. That's an infrared light. And when you put your finger in there, it's going to pick up the blood flow through your little capillaries there, and it will translate that into a percentage of oxygen that's circulating in the blood. So that's how that works.
Well, that's something that I had just recently heard that we would need. As a matter of fact, just telling everybody out there in the world, I had COVID in December, and one of the things that my vasculitis doctor asked me to do was to get a pulse oximeter so that I could keep an eye on my pulse ox levels. I guess that is an early indicator of when you might need more help.
Yes, exactly, because the oxygen level in the blood, it can't pick up the blood can't pick up the oxygen very well. There's a lot of fluid in the lungs, or if there's a lot of infection in the lungs, that interface between the little capillaries and the oxygen in the blood in the lungs, that doesn't enable the oxygen to be picked up well. So I think it's important that in patients that have vasculitis, so many of the vasculitis diseases do affect the lungs, and the doctor may want to make sure that you have the right amount of oxygen. Now, the normal blood oxygen level is generally between 95 and 100% saturated with oxygen. So the doctor, again, is going to need to tell you exactly what your parameter is. There are things that can increase the oxygen level and things that can decrease the oxygen level that we can talk about. Do you want to go ahead and talk about the actual procedure of doing it, or what would you like next?
Yeah, I actually want to ask you a question. I have my pulse oximeter here too. Okay. And I do know that one of the things that I learned is when I first got it, my husband was in there with me and I was trying to read it. Of course, I was frustrated because I'd just been told I had COVID and everything else. And I couldn't get it to read anything, even like what it was reading, I would consider I need to go to the emergency room immediately. So I said, could you? So he tried it and it worked fine for him. And I said, well, am I just not putting my finger in there right? And it wound up being, I had fingernail polish on.
Right, exactly. Yes, and fingernail.
So that's a no-no.
That's a no-no. Fingernail polish. Now, sometimes if it's very light polish, kind of one of those clear glaze, very light, that might not cause a problem. But in general, fingernail polish does cause a problem. Another thing that causes a problem is the acrylic nails. So, those are pretty thick. And this little infrared light that's in there is not going to read through acrylic nails well at all. And in the hospital and in doctor office settings, we can just take off, use some alcohol or polish remover and take that polish off so that we'll have some way to to check the oxygen level. Another thing that can make a difference is when you put your finger in the little clamp. There's, as I mentioned, there's that little red light that's blinking in there. You want to put your finger all the way over that red light so that it can actually pick up the infrared light is working. And I'm going to just show you this and see if you can see that. And it'll show up in just a minute. And it does take it a minute or so to come. So the big number, which says 100 on my machine, that's my oxygen level. Now you're going to see it vary just a little bit. And my heart rate right now is 81. So my pulse is 81 and my oxygen is 99% saturated with blood, which is a good thing.
So that's good. So another thing that I think I learned from you was that I shouldn't be doing this
That's right. Yes.
Much like blood pressure, I should sit still.
Sit still. That's right. Sit still. And a lot of people do kind of tend to tap their fingers or tap their arms or whatever. So keep things still. Another thing also is that if your fingers are really cold, if you just came in from the outside and your fingers are really cold, cold fingers don't pick up oxygen level as well. So make sure that your hands are fairly warm when you have it done. So there's some other things that can change it too. And one of the big things is something like Raynaud's disease. Raynaud's, makes the blood vessels clamp down and you can't get good circulation. So anything that decreases the circulation to your hands can make a difference and make the blood oxygen levels seem lower than it really is.
How about like after exercise, or are there certain medications or there other things like that influence your blood pressure that might also influence your pulse ox?
Well, the pulse ox is supposed to go up when you exercise. And if you're laying down in the bed, let's just say if you have COVID, and one of the things that I know some of my friends that have had COVID, their doctors have said, do not lay in the bed all day. Do not sit still all day. Get up and walk around. Because if you're laying still, the blood is not pushed through the lungs as well. The fluid can settle, that type of thing. So if you're up and walking around, that's supposed to increase your oxygen level some. And so that's one of the big things to do if you have any kind of lung diseases, to make sure that you have some kind of exercise and movement that can help improve your overall oxygen level.
You also need to get guidelines from your doctor as to what they would like to see your pulse ox range and to notify them, right? Because didn't you tell me that there are some people maybe with things like COPD that their pulse ox might be different from somebody who doesn't have?
That's right. And that's a big thing, is because as I mentioned, the normal pulse ox is about 95 to 100%. And so most doctors, I think, are telling their COVID patients, if you see your pulse oxygen level going below 94, that's the time to come to the emergency room. Now, again, your specific doctor needs to give you your guidelines. But if you have a chronic illness, such as chronic lung disease, COPD, and some of the vasculitic diseases obviously do affect the lungs, and if it's caused permanent damage and you've gotten COPD from different diseases, then the doctor may say, I don't want your oxygen level to go over 94 or 95%, because the brain works and tells your diaphragm and your lungs to work in response to the carbon dioxide level. And sometimes patients with COPD, they don't diffuse their oxygen well anyway because of the damage to their lungs. And so the only thing sometimes that makes them want to take breaths is a little bit higher carbon dioxide level in the blood. And so if you put somebody with bad COPD on a really high oxygen flow, sometimes, and it goes up to 100%, that will slow down their desire to breathe. So I think it's important to be sure you get that parameter. Also, another thing that at the hospital where I work currently, as well as at Emory University Hospital where I worked there, we had a lot of congenital heart patients. And congenital heart patients, some of them, depending on what their defect is, the doctor doesn't want their oxygen level going up over about 88%. So there are things that we have to know. So that's why you need to know what's the parameter my doctor is looking for.
And I'm sure if, like in my case, and the doctor told me to get a pulse oximeter and monitor it, he also gave me guidelines. So
right.
It's okay to have one if you just want to have one, but always, like we said about everything else, always talk to your health professional about what your guidelines are. One last question, which might seem silly after all these other questions, but does it matter which finger I put it on?
Well, it really does not matter a whole lot. Now, when I'm checking patients, and if I were going to check mine, I'd put, my index finger or the middle finger. Those are the ones these two usually pick up best. Okay. But you may have to change it and see. So it doesn't matter as long as you get a good reading. But
we feel like these home health ones are reliable. It's not like you have to get one like they have in the doctor's office that has the cord that's hooked up to whatever is monitored.
To the monitor. That's right. And another thing, if you have something like Raynaud's or some other disease that has really damaged your blood vessels in your fingers, you can get a monitor that fits on the earlobe. And those, they're a little more expensive, but if the doctor really needs a good oxygen level on you, then those earlobe monitors can be used. And apparently there are some of these type of little gadgets that have an adapter and that you can put an earlobe adapter into this gadget. So I think that's something that, can be checked on with your doctor and see if that's what you need also.
As always, just refer to your health professional. They're the ones that have all of the answers. We're just giving some guidelines to help everybody. Well, I think that's great. I think that covers what we need to know about the pulse oximeter. So I just want to end up today by saying thank you to you, Jane, for being our medical knowledge today and helping us interpret all these things. I learned so much from you today.
Well, thank you.
Thanks today to Chemocentrics, Genentech, and Amgen as our sponsors of patient education for the Vasculitis Foundation.